Welcome everyone to the Pediatric Success Series podcast. Our goal with this offering is to give you fresh, new, and potentially game-changing insight into recommended practices centered around, well, your practices. While we know information doesn't always change the way we do things, we hope that it can bring about a pause, some thought, and maybe some change. Once again, I'm Sean Rossler, podcast host, dad, and e-learning professional, not to mention culinary talk show host. Today, we're going to look at a topic that, if we're honest, most practices, most providers wouldn't necessarily equate to pediatric success. But they may likely agree that understanding how it works can certainly put us on that path. And that topic is Medicaid. Born in the Vietnam War in 1964, Medicaid has origins that were, to be fair, quite utilitarian in nature. When looking for healthy soldiers, healthy people to defend our nation, the focus shifted from the adult to the child, and ergo, to well visits, to checkups. I'm leaving some details out, but looking at it in such a light, I'll be honest, it makes a lot of sense. Over the years, naturally, the focus has shifted from soldier prep to healthy kids, and that's a good thing. And a partnership has been forged between state and federal government to fund this program, providing care to those in need based on income and ability. Now, if it were that cut and dry, we wouldn't need this interview, right? It works, pediatric care via Medicaid is successful, the end. But there's much more to it than that, and understanding how Medicaid works in a deeper sense is definitely the first step to leveraging it for pediatric success. Joining us on our episode today is Dr. Suzanne Berman, one of our assistant medical directors here at Office Practicum and resident scholar on all things Medicaid. Dr. Berman, welcome to the Pediatric Success Series podcast.
Thank you, sir.
Glad to have you. Good to have you as always. We typically kick the show off by asking our guests why pediatric success is so important to you. Obviously, being a pediatrician, it's clear that successful care, both from practice and patient end, is of the utmost importance to you. But can you tell us a little more about just what pediatric success is to you and why it's so important?
Yeah, so that's a simple question. I would say it has a three-part answer. There's success as far as patients are concerned, success as far as the practice is concerned, and success as far as your practice team is concerned. Pediatric success is growing healthy babies into healthy children and growing healthy children into healthy adolescents and growing healthy adolescents into healthy adults. And that, obviously is ensuring that each child lives up to his or her full potential. That he or she has access to timely, affordable, high-quality care at all ages and stages of his or her life. And so certainly, helping kids, not just help with their illnesses, but actually also preventing illness and injuries is probably what I would say is the patient sort of aspect of pediatric success. Sure. The practice aspect is basically that you can do all this wonderful stuff for kids, but if you don't get paid enough to keep your practice open, that's not exactly what I would call a resounding success. And I see practice all the time that put patients first, which is awesome, but they put themselves they put their own needs as a practice so far back in the needs line that they never get filled up, and you can't keep going when your practice has no money, and so I think it's about putting the oxygen mask on yourself first before assisting the passenger next to you. So you have to have enough oxygen to keep yourself going to assist someone next to you. And thirdly, helping your staff in your office feel successful and validated and fulfilled. The pandemic has definitely opened my eyes to many things, but a lot of it is making sure that our staff feel like they're doing good work as well. I think traditionally, and not so much in pediatrics, but in other practices, perhaps, or other specialties, everything was revolved around the doctor and what the doctor wants the doctor gets, which I think is a little bit hubris, but didn't necessarily, aim to meet the needs like anybody. And so making sure not just that your patients are fine and your practice has enough money to keep going, but that your staff members are in good shape physically, psychologically, and so on. So that's kind of the three parts to your question.
I love it. In 3 parts, three perfect folds, 3 equal buckets. Now, with success defined, over on our other platform, we did the high-level overview of Medicaid, its origins, and its overall purpose. Having kids grow up healthy regardless of their socioeconomic status or ability seems like a no-brainer, right? But I know there's rules. There's always rules, and they vary state to state. So let's start here with, can you share why it's so important to know about these variances and how maybe other state programs can play into Medicaid, again, with success being the end goal?
Yeah, so certainly understanding Medicaid is important for understanding, first of all, the first 2 legs of our stool there, understanding where patients are coming from, as well as where the money is coming from. Understanding both of those aspects of Medicaid are important. So the first, obviously, Medicaid is a health insurer like others, but it is primarily for folks who are from low-income families. There are a few exceptions, which I think we're going to get into later, but for low-income folks. And so when you understand that low-income sort of puts you at a disadvantage for other things like transportation, access to care, and a robust network of specialists, and there's sort of a litany of other things that having Medicaid is sort of at a disadvantage. So when you see a patient with Medicaid, it's sort of good to keep in the back of your head. Okay, if this patient doesn't keep their appointment, it's not necessarily because they disrespect me. It may be because the bus was running late, or they missed the bus, or because the ride that promised to come take them no-showed on them. And they have minutes on their phone to call and say, "Hey, I'm sorry, can I reschedule this? Can I reschedule this appointment?" So that's one, And then as far as the money aspect, we know Medicaid, on average, pays 70 cents on the dollar compared to Medicare and almost all commercial insurances. So when you see a Medicaid patient, you are, as a clinician, automatically taking a 30% discount on the services you provide. And that's when you're trying to balance the budget. You can't ignore that. You can't ignore that number is too big, but you can certainly make that 30% not 50% or 80%. I see a lot of practices just sort of say, "Oh, billing Medicaid is too much trouble. I'm not going to bill it at all." Okay, now you're giving services away for free where you could get something.
Exactly. Yeah, that makes a lot of sense.
Yeah, so that's certainly something. There is variance state to state, and I just want to impress on folks that you definitely need to know what's going on in your state, because I see practices on listservs or forums or whatever, national sharing, swapping pediatric management stories, and someone from Wisconsin will say, "Hey, will Medicaid let you do blah blah blah?" And someone from Arizona will say, "Absolutely not. You can't do that, blah, 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 blah." Well, you can't answer a Wisconsin question with the Arizona answer, obviously. You have to keep your apples in your apple bin and your oranges in your orange bin. And so getting the correct information from your state's Medicaid agency is very important. And if you don't have a relationship with them, or you don't know, okay, do I, email Medicaid at, tn.gov, or, how do I ask this question? Your state Pediatric Council, which is an arm of your state's chapter of the American Academy of Pediatrics, can totally be helpful in setting you straight. Okay, we are in Wisconsin. Here are the Wisconsin laws. We are in Arizona. We are in Tennessee. This is the set of rules we need to live in.
Mm-hmm, mm-hmm. So, I mean, that's the state part. Now, you said something that made me think of another situation, that there are situations where a child can be covered by both a primary insurance as well as Medicaid, right? I know this because our youngest actually has autism and is covered by our primary up front, and then his additional therapies and sessions and so on all fall under that Medicaid. So our provider in this case was really, really helpful in helping us to understand, how to apply for it, where to get it. But I don't imagine that might be a universal experience. And I certainly know why that coverage is important as a parent. But how is all that to navigate as a practitioner, to help them, find that additional layer of coverage? And why is it important that we understand how one coverage plays off the other? We know how the states work, and now how do these coverages work off each other?
Right, and I just want to emphasize what you said. It is not illegal to have primary Cigna or Blue Cross Blue Shield or Aetna or whatever, and secondary Medicaid. It is not illegal. I see questions on forums all the time where folks think that is somehow someone, trying to game the system or commit fraud or something like that. And that's absolutely not the case. About 10% of my practice is double covered, just like you described. They have primary commercial insurance, Cigna, or TRICARE if dad is in the military, and they have secondary TennCare, which is obviously Tennessee's state Medicaid program. That is not, and in fact, in states where the cost of living is low, like Tennessee, we don't. It's still pretty affordable to live here. Then you will find that many folks actually qualify based on, we talked last time about the federal levels, don't have a whole lot of state adjustment, but as opposed to more higher cost of living, New York, California, etc., it is less common to have that sort of double coverage, but it's still not illegal, and it's still not rare, just perhaps a little bit less common, but and knowing how they interact is helpful. For example, let's say your child has primary insurance and secondary Medicaid, and I want to prescribe them a medicine. Now, we know that most insurances have formularies. In other words, this is the preferred kind of drug in this class that this insurance company wants you to have. Some insurance companies in the French fry class want you to have straight fries, and other insurance companies only want you to have curly fries. And if you want straight fries, you have to pay more. And others, it's cottage fries and tater tots, and you can go crazy with this metaphor, so I probably better stop. And let's say the secondary insurance, Medicaid, says, no, we want something different than what the primary wants. So knowing what kind of plan the first plan is helps you decide, okay, do I go with what the primary wants, or do I go with what the secondary Medicaid wants?
So it all comes down to, like you said, that the formulary French fry analogy with regards to that formulary French fry. I think that's what we run with. So then the other side, and this is going to go back to the scenario we kind of painted before. The other side of having dual coverage then is having none, right? And for some, Medicaid or CHIP or some other similar program might be all they have. Is my understanding correct that some practices don't accept Medicaid, leaving folks in what I perceive to be a very bad spot. And if that's the case, like, I kind of almost want to get the op-ed side of this from Dr. Berman. You know, what are your feelings on why a practice wouldn't accept it?
Right. So that's true. So we know that in the United States, about 90% of pediatric practices, which is a little bit different than pediatricians, but about 90% of pediatric practices take at least some Medicaid. And 10% don't. So by far the vast majority do take at least some. Now, sometimes practices limit their acceptance of Medicaid. For example, they might say, we're only taking newborns of existing patients with Medicaid. So if you see 3 siblings and then mom has a 4th baby, you're happy to see that baby. But you are limiting your practice to, I really don't want to see 15, 16, 17-year-olds who are just going to leave my practice in a few years anyway. Other times, what's also really common is, let's say you are in a state where there are Medicaid managed care organizations. That is, the state authorizes for-profit private companies like Centene and United and Amerigroup and Anthem and so on to run the Medicaid programs. Well, let's say you say, oh, well, I want to sign up for some of these programs, and 2 of them will sign you up, but 2 of them won't. That's a horrible problem right now in Florida, where Florida has sort of divided up its state into regions, and if you're on the border of a region, and many patients come to you from that neighboring county that just happens to cross a region, which is sort of an imaginary line created by insurance companies as opposed to an actual barrier, you can't see them because the insurance company won't accept you into their network. Wow. And that's really sort of not your fault. You're trying to provide access to as many patients as want to come to your medical home, but the insurance companies won't let you in their door. So that's sort of a different problem than choosing not to, or I don't want to take care of them. That's sort of a different approach. Finally, there are some practices who don't take any Medicaid at all. And that's, I sort of see both sides of that story. First of all, I think this is America. We still have freedom to choose different things. And if you choose not to see Medicaid patients for whatever reason, I think we should honor that decision. On the other hand, agreeing to see at least a few, I think most practices, if they manage it well, everyone could manage to see at least a few patients with Medicaid. Yeah. Opening your practice to Medicaid does not instantly mean that your practice is going to be overrun with Medicaid patients. You can say, okay, I want to take, 50 families, or I want to take 200 children, or whatever, and say, and this is what we do, and this is my contribution to doing that good work. And just because you do some of it does not obligate you to see every person who wants to step foot in your office. So I think there are ways to manage it that not threaten to overwhelm the practice.
I think that makes total sense. And being the champion you are of and for Medicaid, and certainly the source of knowledge, as far as I'm concerned. I wonder if, for one last question, you could finish the following sentence for me. When practices and providers understand Medicaid, they are better able to blank.
When practices and providers understand Medicaid, they are better able to survive and thrive and help their patients survive and thrive.
Love that. Doesn't it? This is sometimes we can have the big long answers, and sometimes they're just beautiful, concise, simple answers like that. Absolutely. Survive and thrive on both the practice side as well as the patient side. We've wrapped each episode by hearing from a parent about pediatric success and why it matters. I was actually able to reach out to my youngest's case manager at Mission Autism Clinic here in Bloomsburg, Marcy Snyder, and I asked her, how does an understanding of Medicaid's functionality in the care landscape help families feel better cared for, thus leading to pediatric success? Here's her answer. Check it out.
As a provider for behavioral services for children, I can understand how overwhelming it is when you're navigating the world of mental behavioral medical services for your child. It's daunting for sure. It's easy to feel intimidated by terminology, lingo, jargon you encounter as you reach out to service providers and your insurance companies to access these services. Managed care as a funding source for many of these services can open doors for your family. In order to reach what you need, communication is your most powerful tool. Local care managers can provide information specific to you and your family's needs. As a parent or caregiver, you're not expected to be fluent in that terminology, lingo, and jargon used. Ask questions. If you don't understand the answers or you're not getting the information needed to move forward with your search, ask again. It's important that you understand what you're asking for so that you can get your child the services that are needed. It's a very, very confusing world, but if you're persistent and you communicate, you will get the help that you need and the help your child needs.
And there you have it. Just that simple. Again, Dr. Berman, I cannot thank you enough for taking the time to be here with us again and share your wealth of knowledge. So, as always, thank you so much for being here.
Thank you. My pleasure.
Absolutely. You can access the Pediatric Success Series podcast on Office Practicum's website, as well as the official Office Practicum YouTube channel. We hope you've enjoyed this discussion and maybe, just maybe, learned a thing or two either from the parental perspective or the practice perspective. It can certainly be a challenging landscape to traverse, but with patience, understanding, and most importantly, knowledge, it can be done and done well. If you have an idea for a guest or would like to be a guest yourself, reach out to the show. We'd love to hear from you. Be well, stay safe. And remember, success is always a step away.